Hello and happy Friday from this beautiful snowy day here in Wisconsin. Now, again, this is just one of those beautiful days we get to experience, but I wanted to talk a little bit more about what we can anticipate for a year, and specifically 2024. And I say that because there was a recent Aesthetic Leaders Summit that gathered in Barcelona, Spain last month, and they came up with 5 different topics or emphasis that we can anticipate for this upcoming year. And I wanted to share those with you. So the first one was about transgender medicine. And of course, as a practitioner, we have all these tools that we can use that can either masculinize, or feminize an appearance. But there should be a greater emphasis on both listening to patients, understanding our tools, understanding the anatomic difference between a masculine and a feminine face, and doing our best really to help patients have greater freedom in exploring that, having greater outcomes where we can actually help a patient have an outward appearance that better matches their inward self. The second one is somewhat similar. In our globalized economy, we're seeing a greater emphasis on both culture and ethnic diversity. And because of that, we want to be also aware of those differences, aware of those physiologic differences or anatomic differences, and to both celebrate them and explore them, to have a better feeling for what's out there, to have a better application of the tool that we should be using so that patients can actually both celebrate their ethnic diversity and really kind of emphasize some of that as well. The third one is about social media. Now, social media is, as I'm talking here, I know I've done this before, it's kind of, again, hypocritical, but the problem with social media is it can be very dangerous in what it shows people. And what we found from a number of different studies, whether it's people using filters, whether it is that people are distorting their images, whether there are people that are out there influencing that shouldn't, we know that social media has a dark side to it. And the amount of information that's out there is so vast and so inconsistent that there's going to be a greater emphasis on vetting that. We're going to do our best to try to tell somebody, look, why don't you get your medical information from somebody who's in the medical field as opposed to somebody who claims to be an influencer? That is a much more reliable set of information. A number of studies have supported all of that. So I think that's going to be a big emphasis as well. The fourth topic is about regenerative medicine, and specifically something called an exosome. Now, an exosome is a little packet of material that essentially is expelled from a cell, usually a stem cell. And because of that, well, not always, but stem cells are one of the main ones that we often see it from. And these are little messengers and little packets of information that can go out to different cells and induce a number of different changes, whether it's anti-inflammatory, whether it's actually straight up healing, whether it's new vascularization, whether it's anti-aging and getting zombie cells that are stuck in a certain pattern to kind of continue to go through their regular normal development. So those are an area that's going to be a great deal of influence. We're going to hear all about those as well. They're great, they're awesome, they're kind of the next phase in some of the anti-aging topical issues, and we're going to probably see those as the FDA approval process goes forward in other applications as well, in what we call the medical applications, with all kinds of different applications as well, quicker healing for sports injuries, etc. The last one is probably the most important, and that is there's going to be a renewed emphasis on patient safety. And I say that because in the aesthetic industry, there are some things that have definitely hit the news in the last couple of years, outlining, again, some of the unsafe practices that might be going out there. IV therapy bars are coming under some critique. Things like the Brazilian butt lift, where people have done those fat injections and people have died. People where they have had injections of soft tissue fillers, specifically in the upper face, the nose, the glabellar area, causing either skin necrosis or even blindness. Those are things that we know are happening, and in this realm now where there's a lot of pop-up medi-spas, people who are medical directors or of any field, they could be almost any type of MD, and yet they're somewhere halfway across the state or halfway across the country. Again, probably not our best case scenario for safety, so those are going to come under scrutiny as well, and I think those are an issue that we really, truly need to do our best about. So the 5 trends that we're thinking about really coming forward: transgender medicine, culture identity, social media, regenerative medicine, and patient safety. So stay tuned. I think you're going to see a lot of really good information on there, and I think it's really exciting for the state of aesthetic medicine.